Afternoon, everyone. So, in today's topic, we'll discuss cardiac poison. Okay. So this is going to be the last topic of sixth semester. So in cardiac poison, we are discussing the aconite root, oleander, tobacco, and then cyanide. Four poison, cardiac poison. So this is the aconite root. You can see on the picture. So the purple flower, that is the aconite flower, and that on the left side, that is the aconite root. And this is also called mitha bish or monk wood. Dose 1 gram of aconite root or 2 to 5 mg of aconitin, and this aconitin is the active principle of aconite root. Fatal period is 2 to 6 hours. Mechanism of action of aconite root poisoning. So this aconitin will first activate the sodium channel, which causes the increase of sodium influx, and that result in the premature excitation of the cardiac muscle. Okay. Clinical feature that we see in aconite poisoning includes tingling and numbness in mouth, tongue, and pharynx, which is followed by nausea, vomiting, and diarrhea. And other symptoms include headache, giddiness, pallor, profuse sweating. There is weakness of limbs, and the person is unable to walk and stand. Pupils. So there is alternative dilatation and then contraction of pupils, and that is called hippus pupil. Twitching of muscle, spasm of muscle, and convulsion. And other symptoms include there is feeling of chest constriction, respiration becomes slow, blood pressure decreases, and on ECG we will see atrioventricular block. Management. Stomach wash should be done using warm water and weak solution of tannic acid. Either you can use this one or you can use iodine in potassium iodide. And after stomach wash is done, activated charcoal should be introduced into the stomach, which will absorb further absorption of the poison. And the next one is supportive and symptomatic treatment. So atropine should be given if there is decreased heart rate, diazepam, fit, and IV fluid and antiemetic should be given in the case of nausea and vomiting. And beside that, we should constantly monitor the cardiac. And the first medical legal importance. First one is accidental poisoning. So it can be mistaken as horseradish root. So you can see on the right side, this is the aconite root, and the left side is horseradish root. And this horseradish root is edible and mostly used for the treatment of UTI and arthritis. So how to differentiate between this aconite root and this horseradish root? So when we cut both the root, the inner part of the aconite root will turn into pink color, whereas in the case of horseradish root there is no any changes in the color. So that is how you will differentiate. And the second one is ideal homicidal poison, and the reason is it does not have any antidote. And on post-mortem examination, mostly the internal examination, we do not see any specific changes on the internal organ. Okay. And the third one is when we send the viscera etc. for chemical and toxicological analysis, the result comes negative. So these are the three reasons of being ideal homicidal poison. And the third one is avortifacient agent. It can be used as avortifacient agent. Next one is Sorbera thevacea, or this is also called yellow oleander. So you can see on the picture, this is the flower of the oleander, this is the fruit, and inside the fruit nut is present, and this is the knot, and inside the knot seeds are present, and this seed is poison. and this seed is poisonous. Somebody, can you mute yourself? Active principle: sorberin, thebetine, and thebetoxin. So these are the three active principles of yellow oleander. And the fatal dose is 8 to 10 crossed seeds. So the seeds should be crossed, or 15 to 20 gram of root. And the fatal period is 2 to 3 hours. And the clinical feature includes burning pain in mouth, dryness of throat, tingling and numbness of tongue, vomiting, diarrhea, headache, giddiness, dilatation of the pupils. There is loss of muscle power and there will be presence of muscle weakness. Pulse become rapid, weak and irregular. Blood pressure decreases, and at the end there will be failure of circulation. Medical legal importance. So the first one is it can be accidental poisoning. Accidental poisoning because it can be mistaken as edible seed. And the second one is suicidal because it is easily available. And the third one, mostly the root of the oleander can be used to induce criminal abortion. Okay, so these are the MLI of yellow oleander. Now the next one is Nicotiana tabacum, or this is also called tobacco. So you can see on the left, this is the raw one and this is the dry one, tobacco. So all parts of the tobacco are poisonous except the ripe seeds. And the dry leaves of the tobacco contains 1 to 8% of nicotine and mostly used in the form of smoking, chewing or snuffing. And beside that, it is also used as insecticide and worm powder. So that are the use of tobacco leaves. Nicotine is colorless, volatile and alkaloids, and it has bitter taste. So the active principle are nicotine, anabasine and nornicotine. So these are the three active principles. So one cigarette stick contains 15 to 20 mg of nicotine, and out of this 15 to 20 mg, 1 to 2 mg is absorbed by smoking. Okay, and in case of cigar, one cigar contains 15 to 40 mg of nicotine, and out of this 15 to 40, 2 to 4 mg is absorbed by smoking. So you should remember this one. And absorption takes place from mucous membrane, skin and lungs, metabolize 80 to 90% in liver, and the rest in lungs and kidney. And excretion takes place from kidney. Now the symptoms that we see in acute poisoning. So gastrointestinal symptoms includes burning sensation, nausea, vomiting, abdominal pain, and hypersalivation. Cardiopulmonary symptoms includes in the early stage you will see tachycardia, hypertension and tachypnea, and later on you will see bradycardia, hypotension and depression of respiration. Central nervous system symptoms includes meiosis, confusion, headache, sweating, ataxia, agitation, restlessness, lethargy, convulsion and coma. So meiosis means the constriction of the pupils. Chronic poisoning symptoms that we see in chronic: cough, wheezing, dyspnea, anorexia, vomiting, diarrhea, anemia, faintness, tremor, and there is impairment of the memory, blindness may occur, and the heartbeat become irregular, chest pain. There will be presence of chest pain, which may be mistaken as angina pectoris. The withdrawal symptoms includes intense urge to smoke, and there is presence of anxiety. The memory and concentration becomes impaired. There is presence of depression, headache, muscle cramps, sleep gets disturbed, and appetite gets increased as well as weight. And there is presence of rapid respiration and diaphoresis. Diaphoresis means excessive sweating. And the treatment of the withdrawal symptoms includes, so the first line treatment is bupropion. Okay, and the second line treatment is clonidine and nortriptyline. And beside that, we can also use nicotine gum, patches, microtabs, lozenges, inhaler, and nasal spray. So these are the nicotine replacement therapy used for withdrawal symptoms. Fatal dose is 50 to 100 mg of nicotine or 15 to 30 gram of crude tobacco. And the fatal period is 5 to 15 minutes. And the treatment includes first maintaining airway, breathing, and circulation. And then stomach wash should be done using potassium permanganate solution. And the treatment or the antidote of the tobacco poisoning or intoxication is mecamelamine, and the dose is 5 to 10 mg. It should be given orally every day, and the rest is symptomatic and supportive treatment. The last one is hydrocyanic acid. So hydrocyanic acid is also called prussic acid or cyanogen, and it is found in fruits such as almonds, apricots, apple, cherry, peach, plum, pear, bamboo shoots, and this hydrocyanic acid exists in the form of amygdalin. Okay, and this amygdalin is converted into cyanide in the presence of emulsin enzyme by bacteria that are present on small intestine, and the amount of the conversion of this amygdalin to the cyanide is 15 to 30 microgram. Okay, so converted into cyanide in the presence of bacteria in small intestine in the presence of emulsin enzyme. And this hydrocyanic acid is colorless, volatile liquid, has bitter almond odor or smell, and it rapidly decomposes when it exposed to light. And 20 to 40% of the population are unable to detect this smell or odor, and that is due to the genetic defect. Used in electroplating, photography, dyeing, fumigants, metal hardening, pesticides, and printing. And the fatal dose of the hydrogen cyanide is 50 to 60 mg, and sodium and potassium cyanide is 200 to 300 mg, and the fatal period is hydrogen cyanide 2 to 10 minutes, whereas in the case of sodium and potassium cyanide it is half an hour. So among these three, cyanide, hydrogen cyanide is most toxic. So mechanism of action of cyanide poisoning. So first is cyanide will inhibit cytochrome oxidase, and that will prevent the formation of ATP, and this cyanide will combine with the ferric ion and oxygen used by the tissue are blocked, and that will lead to hydrotoxic anoxia. So that means there is enough amount of oxygen present in the tissue, but in the body, but the tissue is unable to utilize it. The clinical feature includes GI symptoms includes bitter and burning taste, numbness of throat, salivation, and nausea. Respiratory symptoms, odor of bitter almonds, and in earlier stage we will see dyspnea and tachypnea, and later on the respiratory rate will slow down and there is presence of cyanosis. Cardiovascular system, earlier we will see hypertension, bradycardia, and arrhythmia, and later on there is presence of symptoms such as tachycardia, hypotension, and collapse of circulation. I there will be dilatation of the pupil and no reaction to light. Central nervous system symptoms includes headache, vertigo, faintness, anxiety, excitement, confusion, drowsiness, trismus, muscle cramps, twitching, convulsion, paralysis, and at the end, coma. And the management of the cyanide poisoning. So the management or the aim of the treatment in case of cyanide poisoning is to convert toxic cyanide into non-toxic thiocyanate, and which is excreted into the urine. So first one is we should maintain airway breathing and circulation, and after that break 0.2 ml of ampoule of amyl nitrate in a handkerchief, and then it should be held into the patient's nose for 15 to 30 seconds. So that is the first step after ABC method. And the next one is 0.3 gram of sodium nitrate in 10 ml of sterile water is mixed, and it should be given IV over a period of 5 minutes. And the third step is 25 gram of sodium thiosulfate is mixed in 50% of glucose solution, and it should be given over a period of 10 minutes. So this amyl nitrate, sodium nitrate, and sodium thiosulfate are the antidote of cyanide poisoning. And besides that, symptomatic treatment. Medical legal importance. So first can be used as suicidal poisoning, and the reason it will cause painless death. And the second one, it can cause accidental poisoning, and that is due to the inhalation of the fumes by workers. And the third one, it is used as judicial execution in some countries. Okay. And the fourth, putrefaction, or in the case of decomposition of the body, there is the production of the cyanide, but the amount of the cyanide production is very less when we compare to the cyanide poisoning. So you should not mistake this putrefaction with the cyanide poisoning. And the third one, last one, is cyanide can be used as chemical warfare agent. So chemical warfare agent means any chemical that is used as a weapon during war. So these are the 5 MLI of cyanide. Okay, so this much in the cyanide poisoning. Let me take the attendance first. So for the semester exam, so you should read whatever the topic we have discussed in the 6th semester plus the assignment that I have given in the online classes. So do not try to skip that one. It is very important, each and every topic and the questions. So anybody has to ask anything about the semester exam? Any question regarding the semester exam?